All right, we are live once again. Today we'll be talking about our healthcare infrastructure. Once again, good friends, Evie Bateman and Dr. Yamicia Connor. I'll just turn it right over to you, Dr. Connor. Get us going.
Yeah, hello. Welcome everyone. I see everyone joining. So thank you for being here. This is our second episode of Architecture of Harm. So today we're going to be finishing up from where we left off last time, and then adding some new material. I also wanted to make it a little bit more personal. I wanted to start tonight, like, actually talking about the 6 women, at full length and, like, kind of telling their stories because I don't know, I've heard I've read a lot of things in the news about the women dying from, basically mismanagement of, like, miscarriages and PPROM, but I haven't seen a lot of places actually explain to people what is happening, especially not from a clinical perspective, and I think that's really important, because I think people need to understand how these women are dying. Um, in my opinion, it is almost like homicide. And I'll explain to you why. These women did not die peacefully. They didn't, like, go in their sleep. This is dying in agony, and I think people should just understand what their policy looks like on a human body.
Should I bring those pictures up again, or those 4 case
Mhm.
studies you mentioned before?
Yeah,
Okay. If I get this one. There we go.
yeah, and so the first thing to mention is these women didn't die of abortions. They died of failure to manage complications of pregnancy. And because they happened to use the same instruments as would terminate a pregnancy, they ended up dead, right? And so I want to, from the perspective of a physician, what this feels like to me, imagine you're a trauma surgeon and a man comes in with a gunshot wound and he's bleeding out, right? And then as the surgeon, you are standing there and you're thinking, well, this man might have committed a crime somewhere, and therefore, should I help him? And instead of helping him, you watch. You watch as the blood leaves his body. You don't you know you have the capabilities, the training, the moral, legal obligation to help him, and you don't. And in any other framing, we know what to call this, right?
Mhm.
This isn't a policy disagreement. You wouldn't say, "Oh, that surgeon was in a difficult position. It was just so complex. How could he decide?" Right? It's clear. It's absolutely crystal clear what should have happened. And what I want to communicate is from a medical perspective, it is crystal clear. And this is not just coming from my opinion. If you read these cases have all been evaluated by different medical boards, by different review boards. They have said unequivocally that these deaths were preventable, that the doctors knew what to do and they failed to act. And to me, that is, as a physician, like, I'm almost getting emotional. As a physician,
Yes.
that is horrifying. I mean, I honestly don't know how you can how you could come to work the next day.
Yes.
Like, I just don't know how you could come to work the next day, and that's what I think. Not being dramatic, not making this about, whatever, like, people's, religious views, not any, let's put all of that aside. As a physician, you have a person that is dying in front of you, and you watch them die and you do nothing. I I honestly, it's just,
Yeah.
and I haven't heard people explain the cases in a way that makes that crystal clear, and that's what's missing, I think, from the conversations. These hospitals, they killed these patients. I just wanna be very clear. There is a name for it in law when you cause the death of a person because of a conscious disregard to a known and obvious risk to their life. That's depraved indifference. That's negligent homicide. In medicine, we call that abandonment, right? None of these women died of an abortion. That's what I need everyone to walk away with. No one here died of an abortion. They died of a miscarriage. They died of sepsis. They died of retained products of conceptions. They died of molar pregnancies. And the treatment, because it uses the same instruments that would end a pregnancy, and because these laws have been written with no, at all, no, nothing that resembles understanding of like pregnancy physiology or obstetrics or anything that resembles the relevant piece of information you need to write competent law if this was your intent. Because of those reasons, these women are dead.
Yeah.
And we'll go through the cases, but the way that they died, I'm sorry, when I was going through it, I was horrified.
Yeah.
We can go to the next slide.
Okay.
So, Dr. Connor, are these doctors that aren't treating these patients, is it because they had like a moral sense or, it was conflicting with their morals, or was it because they're not being protected because of the laws that are being made? Or, I mean, what is the reasons for that? Because I feel like um, this is something that correct
Yeah.
me if I'm wrong, but this is something that has just recently been happening more so.
Yeah, Walter, can you go back one slide? I think you skipped. I don't know, actually. I asked myself, oh, oh,
Nope.
maybe there's
Not this
one.
one.
Okay.
Because
Oh,
here
oh,
in
sorry. This is
Texas,
the
I know that doctors are really afraid because, Texas is kind of the authoritarian, science
old deck,
experiment right
Walter.
now.
Okay, you want me to do one? Okay.
Yeah, you can go to the new one. I'm so sorry. I need to get my husband to grab my son. Give me 1 second, everyone. Sorry. He's not gonna stop banging on the door otherwise.
Okay. But I think that gives us a time, Evie, to talk about just the complete failure of the media and the complete failure of our media structure when it comes to this. These things aren't being reported. Exactly as you said, it's been happening more often. For whatever reason, I mean, this should be part of every political debate. Should be on the media all the time. People should be
And
able
I
to.
do I mean, I remember, the media did mention, they didn't, that it was mentioned and then it was kind of off into the wind. But I do remember a couple of those women, that had passed, and it was more of like, doctors were afraid. They were
Yes.
afraid that if they did something, they were gonna get arrested and go to jail for the rest of their lives, or they were afraid because, all of the laws weren't specific enough to where there was too much gray area, and if they did the wrong thing or if they used the wrong instrument, like Dr. Connor had said,
Yes.
just using the wrong instrument would land them in prison, and I think they were just afraid to lose their
Yes.
license, they were afraid to lose their livelihoods, um, which, I get to a degree, but if somebody's dying,
Yes.
at some point you have to make that moral decision to help them, because it goes against doctors' ethics and everything, but
Yes.
I don't know, I think, I always tell people, look at Texas right now because Texas is the authoritarian, uh, science experiment that
Yes.
they're they're kind of testing it out here because this is happening across all 50 states eventually. But I guess my question was, Dr. Connor, these doctors that are not treating, it feels like this is something that just started happening in the last couple of years when the abortion bans went in and all that.
This is 100% due to the fall of Roe. This is not,
Yeah.
this is a consequence of Dobbs, and this is what people have been predicting and
Right.
warning about. This is what this looks like.
Mhm.
This would have been malpractice, no problem, no question,
Mhm.
in any other time, no question. This
Right.
is malpractice at the minimum.
Uh-huh. Are they being will they face litigation then for losing these patients, these
I
doctors?
don't think so. I don't think so because again, like, because it's hard to know what like their actual constraints are, and I don't know what the discussions are internally with the, you know, within the hospital system or the legal teams or, but what I will say is like, um, a lot of these prosecutions are state level. This is a state law.
Mhm.
And so who would bring this prosecution? The federal government? Like is it that would actually bring it? There's just
Right.
no body that can hold these people accountable.
But what about the
And
board?
the
You know,
medical
like,
board, that's a
the
good
board is
question.
saying
But then the medical board again is so every, medicine is really practiced regionally.
Mhm.
Like I am a physician, right? I have a medical, I have a degree, right? I have a medical license, but that license is specific to a state. If I want to practice medicine in a different state, I need to get a different medical license. And so it really is state dependent. The practice of medicine is very local.
I'll have
Mhm.
to ask Erica Kopp about this, being a healthcare lawyer,
Yeah.
because there's jailing, but there are also other consequences. There can be financial consequences. You could sue for
Right.
wrongful death, and I would think that once it doesn't bring people back, but we have to have some sort of a consequence that makes these doctors understand
Well,
that the danger of
well,
not saving life is worse.
but you understand, but it's the same thing that keeps police from having to face accountability, right? Like there are
Mhm.
a lot of things in the law that are in place. Like the reason, like police can go and shoot you, and you can't. A lot of times, you can't even sue the police, right? They
Right.
could like literally kill you for no fault of your own, and you have
Mhm.
no recourse. There are things in the law that prevent. They have basically blanket immunity if they're doing their job. And so I would guess that this probably falls into that bucket.
Mhm. Mhm.
We'll have to get some legal minds to talk to
Yeah, no,
them.
that would be if anyone knows. I mean, I don't know that from the legal side, but from the medical side, I think
Yeah,
the answer is very clear.
yeah.
Mhm.
And it also there's a difference because as I was saying before, I think the practice in Dallas is very different than practice in Houston. Well, I mean that's the same state, right? They actually have very different outcomes. Like you are more likely to die in Houston from one of these issues than you are in Dallas. So some of it is because um, you actually have a lot of autonomy as a doctor. Doctors is one of those areas where more or less within some reasonable line of behavior, you can kind of do what you want, right? If you have medical justification, if you can document, if you can stand by it, you can do it, right? And so I have been in positions where I've had patients with septic pregnancies, and I just told them the hospital, we're taking this patient to the operating room, and this is the reason why we're going to face. I think I get and I don't live in as restrictive of a state as North Carolina. I mean, sorry, as Texas. I live in North Carolina, but we still have minimums. And if a patient's gestational age is above that, I have very clearly documented it. Said this is why this mother will die. This is what the law says, and I'm taking her to the operating room, and this is what's going to happen, right? And uh, really nobody it's very hard when a physician takes a stance like that for who's going to come and stop me, right?
Yeah.
Maybe they can agree to not participate, and that's their right. But usually, when you are trying to explain to people like this woman is going to die, I mean, if you want to sign her death certificate, that's on you. Like I'm not going to say that I agree with it. So if the
Mhm.
hospital wants to physically stop me, physically keep me from taking her to the operating room, fine. But when I'm documenting in the medical record, my medical opinion is if I don't do the surgery, this patient's going to die, and if she dies, I've documented it. That
I was
Yeah.
just gonna say too, I mean, it's so heartbreaking. Why we're talking about this is just for the sake of trying to save lives. And if we have to do it, I mean, doing it through the medical way is important. Having the conversation about legal repercussions is
Mhm.
really, really important because it seems like people are just kind of sidestepping that. It seems like because they wanted to avoid these patients that you mentioned before were allowed to die because people were trying to avoid
let's go
the
through
legal
the cases
repercussions.
because when you hear the cases, they are very painful to hear.
Next page,
We
then.
can yeah,
Oh,
next
there it is.
one, and then the one after that.
Okay.
So, okay, with the young woman, the one back there. We'll start with
I
that.
go back? Okay.
One back, yeah. Yeah, that one, okay. So the first case we're gonna cover is, Amber Nicole Thurman. Some of you might have seen, her story, on social media, and so, briefly, she was a medical assistant, she was training to be a nurse, she was a single mother, she already had a six-year-old son, she, from all accounts, was a good mother. The stories describe her taking her son to petting zoos, museum. She just moved into a new apartment. She was building something. She was building a life, and I, I am partnered. I am not a single mother. When my husband goes out of town, I feel like I'm gonna have an anxiety attack.
Mhm.
I don't know how, single mothers do it. It is remarkable, the number of single mothers that are able to do this on their own. Raising children is incredibly hard. And so in the summer of 2022, she got pregnant with twins. I have twins. My first pregnancy was twins. They're now 5. And I will tell you, I was 8 weeks postpartum, and I remember just, like, standing in the middle of my room because we would do, like, shifts. Me and my husband would do shifts. And, I had the night shift, right? Because with twins, you have to essentially, babies have to eat every 3 or 4 hours, right? And so by the time you feed one, change them, burp them, do all the things, pump, the next one needs that same cycle, right? And so it's literally almost 24 hours of childcare, just continuous, nonstop. And we had lots of help, like, my parents were there, his sister was there, and we had, like, bottle stations, we had, like, diaper stations. It was like a factory taking care of 2 babies, and I say all
Mhm.
of this because this woman is a single mother with 6 children, has twins. I wouldn't be able to take care of that. I wouldn't be able to take care of t twins with a six-year-old. I know my personal capacity, I wouldn't be able to do it. And so she made a decision for herself that for all practical purposes, makes a lot of sense. However you feel about it, it makes a lot of sense. Unless you have done it, it is hard for you to actually comment on what's feasible for another person.
Mhm.
And so she was in Georgia. She got, on July 20th, the Georgia 6-week ban took effect. She had just passed 6 weeks. So she was waiting for the courts to reverse things. The courts didn't reverse it. And so at 9 weeks, she and a friend drove down to North Carolina. They were stuck in traffic, so they were late. The clinic was drowning in out of state patients because,
Mhm.
obviously this caused a whole lot of people to panic, and rightly so. There's not that many places. North Carolina became one of the only places you can terminate a pregnancy. That was in the geographic South. And so because, the clinic was running behind and she came in late, they couldn't hold her surgical slot. And
Mhm.
so they gave her pills instead. So this was medically appropriate. She was under 10 weeks. They told her, "We know that these pills have a certain complication rate. All medications have a complication rate, and we'll talk about that later." They gave her the first pill in clinic. They told her to take the second one at home, to go to the emergency room if anything goes wrong. So on August 18th, she went to the Piedmont Hospital. She was vomiting blood.
Mhm.
She had lost consciousness at home. So that means she probably already waited a bunch of time at home, because that's not the first symptom you have. The first symptom you probably have is a little too much bleeding. By the time you get to vomiting blood, she's probably been dealing with complications from this incomplete abortion for a while. So she had retained tissue. She was septic, and the treatment for that is a DNC. Period. No
Mhm.
questions. She needs to go for a DNC. This is a procedure. You can go to the next slide.
Okay.
This is a procedure that takes minutes, right? And so, literally, I the procedure itself probably would take maybe 10 minutes. Getting her to the operating room, registered, doing all that stuff, maybe taking an hour and a half. She She should have been better. She should have been trying to recover. This is something literally every OBGYN knows how to do. When you've trained OBGYNs, the first thing you teach them is how to do a DNC. Like this is literally this is our bread and butter. It's like a general surgeon who knows how to take out a gallbladder. You can do it in your sleep. It is the most common procedure that we do. And there was no question like what needed to happen. No question at all. The hospital saw it immediately. She had all the signs. She had an elevated white count. Her blood pressure was low. She had abdominal tenderness. She had foul odor. An ultrasound showing retained tissue. There is nowhere on the planet is an OBGYN going to look me in the eye and tell me that this is a confusing diagnosis. If they do, they should lose their license, because this is like, telling a cardiologist I have chest pain and they don't do an EKG, right? It's that reflexive. And so I say, like, when she came in at 6:51, I told you this procedure could have been done, let's say 8:30, right? She didn't even get antibiotics till 9:38, right? And so antibiotics are first mentioned, then the DNC is mentioned for the next day. That's completely inappropriate management. She should have had the DNC immediately. And now, mind you, did I tell you that there's a heartbeat? No. Did I tell you
Mm.
there's a baby? No. There's no I just need everyone to understand that. There's no baby. No matter how you feel about an abortion, whatever's happening now is not an abortion. There's no baby left. I just want everyone to realize there's no baby left. There is just tissue rotting inside her body. Babies are gone. There's no baby left, right? The only thing that is appropriate in that setting, even with the law, right? Because there's no baby left, right? Is you need to do a DNC. There's no ambiguity. That's the thing that makes me like furious. And so the next morning at 5:14, you have acute severe sepsis documented. And I want everyone to understand like what's happening in the background. It's not like the doctor is, just taking a nap. They're getting hammer paged by the nurses, right? Because no nurse worth her salt is looking at this patient actively decompensating. I mean, they need to call the doctor, right? Their things are triggering. The vital signs are being triggered. Lab values are being triggered. There are a million different things telling you in the system this patient isn't okay. And so the fact that they waited almost 12 hours and without even really fully documenting it is absurd to me. Again, it's absurd. It is like under what planet does this happen? It is so absurd.
Mm.
Now we get to almost over 24 hours. That's when they first discuss, a DNC. They don't do it then. Now you're at midday the next day, and I'm sure that ICU doctor came in and was about to shit their pants. Like, what the hell do I have in my ICU? I have a patient that needs a DNC. I have a surgeon who refuses to take them. This woman is dying, right? And so that ICU doctor midday is warning the OBGYN she's deteriorating. She needs to go. And someone just said this breaks their heart. It should,
Mhm.
right? It should, right? This should break your heart because it is unthinkable to do this to a human being. It is unthinkable to do this to them. And then by now 2 p.m., right? Almost a full 24 hours, 20 hours in, she finally reaches the operating room. And when she reaches the operating room, it's not a DNC anymore, right? It's something else completely different, because this is a patient who's on death's door,
Mhm.
who is crashing. When we say crashing, everyone's probably seen ER, right? Or some medical show. When all those bells and whistles are, that's what she looks like, right? So her bowel became ischemic, right? Because when you're septic, what happens is you lose peripheral blood supply, and your organs start to die, right? Like that's what sepsis is. And your body is trying to protect your brain, essentially. Everything gets shunted to your brain, your heart, right? Your heart and lungs. And everything else gets compromised. And so when they went in her abdomen, her bowel was ischemic, meaning dead, right? And you don't come back from that.
Mm.
She didn't have enough blood circulating through her body at that point, and her heart stopped on the table. Before she went into the operating room, she told her mother, because she knew she was dying. I mean, you have to when people are dying, they know they're dying. If anyone's ever cared for, somebody who, is elderly, who is in their final days, they know they're dying. You feel that. You feel death coming, right? And she told her mother to promise me she'll take care of her son. And her mother, poor woman, didn't even know that she was pregnant until the hospital called her, right? And so right there are 3 lives just destroyed. There is a child who lost their mother, there's a dead woman, and a woman who lost her child, who now has to care for her grandchild, all in the span of 20 hours, and for what? What? Like, what was the benefit? I already told you the pregnancy was gone. There's no pregnancy left. So you killed this woman for what? For what purpose? And that's the thing that is just so sickening to me. And I think people need to tell the stories, right? I think people need to understand the stories. They need to tell people and tell them what this looks like. And then tell me, if you believe in life, this is what this looks like? This is what God would have wanted? Right? This is Christ's way? Like, it's just so absurd. You can go to the next slide.
Okay.
And I'm sorry, I should have given everyone a trigger warning, because this could be pretty triggering, so forgive me for not giving it, beforehand, but, uh, this the cases or the patient stories are like this, and so if this is very emotional, I completely get it. If you're not always in the mood to hear this, then we can definitely do a recap, that talks, less about the acute details. But I think it's important that we
Yes.
we 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 explain to people what is happening. And so these cases were reviewed by 32 experts, 10 of them of physicians, and you know, they're not as, in my opinion, honest as I am. They said the delay had a large impact. And the people who said that the delay had a large impact, to your question, Evie, lost their seats on the board.
Yeah, I can imagine so. I know, when I had my DNC, when I miscarried when I was 20, I went from clinic to operating table. Like, I mean, she just said, "Go make some phone calls and go to the go to the OR and get prepped for surgery." There was no waiting. It was
Yeah,
just I went to the clinic, I was bleeding, I went to the clinic, she said, you know, "You're bleeding really heavy, we're gonna get you into the OR, so go make a couple of phone calls and then meet me there in 15 minutes." There was no waiting.
yeah, yeah. In her clinical scenario, there's very little excuse for waiting. I mean,
That is
every
horrific,
clinical case is slightly
horrific.
different, but by and large, this was inappropriate.
So, for some clarity on this, there's a 32 member panel to review a case exactly like this, presumably for the purpose of saying, gee, something horrific just happened in our medical health structure that we have to address. And these 32 members did what they were supposed to do and say, this is a problem. And the response of our authoritarian government just removed the people saying that there was a problem.
They
And then,
they just dismissed it. No, they got rid of the committee.
and so
A
that
lot of
they
the
did
states
they
are looking at
replace?
that. So the don't I mean, what's in their place? I mean, whatever,
Well,
I don't know.
so now they get 32
Because
people that say
action
this is
without
fine.
accountability, like, there's really no true accountability for anything, and I think
I
that's a huge thing that's happening right now in the medical field is they're just kind of, like, making things go away without actually having accountability. I
And it's
mean,
hiding the databases like Dr.
yeah.
Connor has mentioned too, like all the actual facts, and the
Mhm.
media will not cover this stuff. And I mean, as
Who
hard as
murdered
this
that
is, I
woman?
applaud I applaud everybody for being here. We have to know the facts. This isn't gonna go away if we disregard it.
and I was also
Mhm.
really I had to I mean, I had to dig. So these are not new stories. Let's just be clear. I had to dig deep to find all of the details.
Mhm.
This is something that should be on the in my opinion, should be on the front page of like, when anyone's talking about this, they should be talking about it in this way, because I think it's important to tell people what you're talking about, right? If you want a policy that's going to kill people, I think you need to look at how they die with both eyes.
Mm,
That is the least that you owe people, and
absolutely.
you cannot hide from that. Like, I mean, that is just it's just despicable, right?
Yeah.
If you are going to be cruel, if you are going to have policies like this, then you need to look with both eyes.
And not only that too, but this is our reality right now. This is something that's not going to get fixed overnight. So, talk to your daughters. Like I've got a 21-year-old daughter right now, and I tell her all like, please be careful. This is no time to get pregnant. This is no time to even think that it's okay to be pregnant. I mean, I feel sorry for the women, especially, there was a story that I read about how this woman had just gotten married and she was looking forward to having a family, and then all this stuff happened, and now it's delaying her chances to have a family. But, when you look at things like this and you're hearing stories like this, the delay is worth losing your life over. It's just not safe because you just don't know when it's going to happen. I had very, very healthy pregnancies except for that one, and that one almost killed me. So, you just don't know, and it's just not safe for women to be having babies right now. It's really just not safe.
And these repercussions for the experts for using the scientific process and evaluating, that's gonna too have a ripple effect. Where now we're gonna have experts who are afraid to give what they think
Mhm.
are accurate interpretations of scenarios for the sake of facing repercussions there, which is going to
That
in turn lead to more
Well, I mean,
negative
that's
outcomes.
very clear why, like, our specialty, that's one of the underlying reasons for the crisis that we're having in our specialty. Because as a medical student, I mean, like, who wants to be put in this scenario?
Right.
Like, why would anyone ever elect to I mean, I I could not practice there. I could not. I mean, I would get arrested. Like, like, I know I couldn't, right?
Mhm.
'Cause, I could not sit down and watch someone just die, and if I was made to, I have no idea how I would respond, but it definitely wouldn't result in me having a job the next day. I know I couldn't practice there, so I have no business even being there, right? Like, I could not do it. It would, like, break my mind. Like, I don't even know
Mhm.
how to say it. Like, I would be broken.
It's
I
like a
couldn't
rock
I
and a hard place right now, There's
yeah,
consequences on both
I couldn't watch
sides.
someone
There's
die like that.
consequences for the patient, there's consequences for the
Yeah,
doctor, and it's just you're between a rock and a hard place. It's horrible.
Mhm.
yeah. I mean, I couldn't watch someone die like that. Next
Yeah.
slide.
Okay.
And so, I want to talk a little bit about what sepsis is. So especially in young people, because this is something that we train new doctors about. Because young people have a lot of capacity, right? It's actually pretty hard, knock on wood, um, for lack of a better word, to, like, kill a young person, right?
Mhm.
Without medical negligence, young people can withstand a lot, right? Because 'Cause they're young. They have healthy hearts, they have healthy organs. If this person was older, she probably wouldn't have left the emergency room, like,
Mhm.
it would have been game over, right? But she was young, and so, um, what that can sometimes look like is patients can look, relatively stable while the infection is actually really, really bad. And as a physician, this is like training 101, right? Like, this is what you teach your residents and your medical students. Don't let that person fool you, right? Like, that person looks fine now, but that we have a clock and that clock has started. And this is what happens on that clock. You have an infection, and this leads to an inflammatory cascade. And then then you have the thing starting. And once you start going down this slope, you are in a bad way medically, right? And so your job as a doctor is to, you know, be moving like hell during the infection, like, at the beginning, you are trying to move the process along, because you don't want to be in a position where you are on this downward slope, because it gets harder and harder and harder to reverse things, right? mortality rises every hour of delayed source control. Like, this is not a time where you're, like, sitting diddle-daddling, you know? And that's the other thing, the reason I brought up the timeline, because when you have a patient like this in the ICU, right, you're at their bedside. Like, you're not really doing much else, right? You are at their bedside, you're persevering, like, when you're truly trying to make a decision, and really worried about someone, this is a patient that is top of mind, because this is the sickest patient you're taking care of, right? And so that's what I want to make clear, right? And then once you get down this pathway, reversing something like that is very, very hard. And so young patients have a lot of reserve until they don't. And you'll see that in another one of the stories. Many of these women will die on the operating room table, because they're in this process. They're actively physiologically in this process. Next slide.
Okay.
So this next patient is Candy Miller. Let's see. So Miss Candy, what was her story? So she was a mother of three, um, and she had a history of lupus. So she already had three kids. They were ages 5 to 16. She braided hair. She did nails. She, from all accounts, was like the life of the party, a firecracker. She loved gardening. She loved funk music. She was older. She was the oldest of the patients that we're going to be talking about today. I think she's in her 40s.
At 41.
She 41, yes. She has had lupus, diabetes, and hypertension. Um, so she's had 8 years of lupus pain that was bad enough to need radiation. She had lost her hair. She had swollen joints. Um, Doctors have repeatedly been waving her off, and to the point that she stopped trusting them. She was told repeatedly the maternal death rate for women with lupus is 20 times higher. Her doctor made it very clear another pregnancy might kill her. She has three children at home. And so in the fall of 2022, when she found out she was pregnant, she ordered pills. And again, very similar story. These pills have a risk of retained products, but which can be managed, right? We know how to manage it. We manage it with a DNC. But she was so afraid of what might happen that she spent days bedridden in excruciating pain.
Mm.
There are reports that her son could hear her moaning through the wall.
Mm.
On November 12th, her husband found her unresponsive. Her 3-year-old daughter was lying next to her in the bed. On autopsy, she had unexpelled tissue, and there was a lethal combination of fentanyl, diphenhydramine, and acetaminophen. This woman had no history of drug use, and so the medical examiner concluded that it was not, or could not conclude, why she took these substances. What they thought is she was likely trying to stop the pain, right? She was in excruciating pain. Um, Her sister made it clear that she was not trying to terminate herself. She was trying to terminate a pregnancy, right?
Mhm.
And so when this was reviewed by a committee, again, it says the fact that she felt that she had to make these decisions, that she did not have adequate choices here,
Mhm.
that influenced her care. So she died, unfortunately, because she was too afraid to see a doctor. We do next slide. So some of this I already covered. So the 20 times, you can do next slide.
That'd be the next.
Next patient. So this is Miss Jocelyn, I think. So she was from Honduras. She hung drywall for a living. She had a 1-year-old daughter, and was pregnant with her second baby. On September 3rd, um, uh, she was 17 weeks. She woke up because she was in pain and bleeding. The miscarriage had already started. Um, what they found is that her cervix was opening. Um, this provides a clear way for bacteria to enter the body. When her husband and her got to the hospital, she was told by staff that they had to wait until there was no heartbeat and that it would be a crime to give her an abortion. So they waited 40 hours. Next slide, I think. So she waited 40 hours. Um, uh, but on September, so sorry, my children.
Oh, it's
But on September 5th, at about 4 a.m., they presented again. A heartbeat could not be found, and the doctor finally delivered the fetus. She was discharged later, um, about 8 hours later, still bleeding. On September 7th, 3 days later, she came back hemorrhaging and died of sepsis for retained products of conception. Next slide. Um, Another story. So this is a young woman. She's 18 years old. She just graduated from high school. She was 6 months pregnant with a daughter. She was going to name Lillian. She had a boyfriend and a mother who supported her. On October 28th, 2023, the morning of her baby shower, she woke up with a headache. She had nausea, vomiting, fever. Her boyfriend had to like open the presents while she was fighting to keep her eyes open. Finally, they took her to the hospital. She's at Baptist. So again, this is a desired pregnancy. They're celebrating the pregnancy. Baptist Hospital opens at 3 p.m. They spend 4 hours in the waiting room. She gets a positive strep test. Nobody examined her abdomen. Nobody gave any notice to sharp abdominal cramps. They sent her out the door at 9 p.m. with antibiotics. Visit 2. She goes to a different hospital. This is now, so it was 3 p.m., 12 hours later. She has a fever of 103. Her pulse is racing. The nurse charts that she has abdominal pain, 7 out of 10. She screens positive for sepsis. She gets 2 hours of fluids, antibiotics, and Tylenol. The fever won't break. The fetal heart rate is fast. She gets discharged from the hospital anyways.
God damn.
I'm telling you, these stories were horrifying. They wheel her out. She can't walk. Her mother is looking at her, looking at the doctor, saying, she's breathing heavily. She's hunched over in pain. She's pale in the face. At 7 a.m., she finds blood. Visit 3, 9 a.m., same hospital. She comes back, lips drained of color, saying over and over she's going to pass it. Now, I'm telling you, as a physician, I'm reading this and I am like losing my mind. So I have like a two visit test, right? If someone has come back to me and this is their second time they're seeking care, and even if I don't understand what's going on, I have a very high threshold to admit them because something is going on. Like, maybe I don't understand and maybe it's still developing. Maybe we need to run some tests. But for someone to go to the emergency room within 12 hours, something is wrong, right? Because no one wants to be in the emergency room. It's one of the most unpleasant experiences in the world one can imagine, right? It's like going to the DMV. Like nobody wants to be there. So if you're there again, there is a reason. And that rule that I have has served me well because there's people who, turns out 12 hours later, they finally declared themselves. Something was wrong. We didn't have enough data. We needed to watch them more. And so the fact that she gets sent home 3 times, like I'm like literally I would be panicking, right? Like I would be if one of my residents, one of my fellows told me that they did this, I would be irate. Like, what do you mean you send them home? Why? Well, I mean, like, until you can prove to yourself that this person is fine, the answer is never sending them home. This is what the hospital is for, right? I always tell people one of the best diagnostic tools we have is time, because sick people usually get sicker, And that is a data point, right? What happens again in 4 hours? What happens again at 8 hours? Because you see, like, if there's anything that anyone can take home, and learn for themselves when you go to the doctor, right? Like, this is important. Sometimes the right response is observation. All right, you don't know what's going on? Fine, admit them to the hospital, watch her. You have a right to request that. I watch her. Like, I don't fine, all the tests are negative. I don't feel comfortable going home. She is not safe going home. You need to say those words, say them very clearly. I do not feel safe going home, and you need to have them admit you to the hospital. Now, with that said, some of these women were admitted and they were mismanaged, right? But at the very least, they have an obligation to admit you to the hospital. And so she comes back 9 a.m., her visit 3. It's obvious that this woman is sick. Her lips are blue. She looks unwell. Her mother, this is the eyeball test, right?
Mhm.
The eyeball test says, I can see a sick person. Like, just you guys can, if you saw someone who's that sick, they look sick, right? They don't look well. They order an ultrasound. Shows no fetal heart rate. They give her condolences. And then this is the part that literally broke my brain. They ordered a second ultrasound. I like saw that and I like felt like I could like throw my computer across the wall. Like, they ordered a second ultrasound. And the nurse documented that the ultrasound was ordered because there is a slight chance the patient may need to go to the ICU, and the doctor wanted a bedside ultrasound to be done stat for sure before admitting to the room. So at 10:40, this patient's blood pressure is dropping. By 11 a.m., 2 hours after she walked in, and I just told you every hour matters, right? So they're just wasting time, wasting time, wasting time. A second scan to confirm the exact same thing as the first one, which is the fetal demise. By 11 o'clock, she's in the ICU. She can't sign the consent form. She's in too much pain. Her lips are blue and dusky. This is what someone looks like when they're dying. So she's in DIC. She's bleeding from everywhere. So I want to stop here and explain what DIC is. If anyone's ever seen like a movie, like a pandemic movie, right? And when you have like this killer bacteria, and you see people who are bleeding from their eyes, they're bleeding from their nose, they're like bleeding from that's what DIC is.
Wow.
When you are bleeding and clotting at the same time, this is the last stage of life, right? So she died hours later. And the medical examiner, not the hospital, actually removed the baby from her body. 9 doctors reviewed this chart. All 9, and they were being generous, in my opinion, but all 9 said she should have never been sent home the second time. And one of the doctors documented, I'm sure they also are no longer on the committee, that this is how these restrictions kill women. And
Mhm.
her mother, her poor mother,
Mhm.
just kept asking, why didn't they do anything to help her instead of wait for another ultrasound to confirm the exact same thing, that the baby is dead? And I want to stop here to just make that clear. You can go to the next slide, I think.
Okay.
So this is her timeline, right? Um, so the second ultrasound is so incredibly problematic for I don't even know. So number one, let's take a couple steps back. If you have an infection in pregnancy, that's called chorioamnionitis. That is an emergency. The recommendation, no matter where you are, which gestational age, is delivery. Period. That's it. There's no other management. You need to be delivered for both your benefit and the benefit of the fetus. So even if your goal is to take care of the baby, then you need to deliver her, right? Because we can manage preterm deliveries. We do it all the time, right? This no one even mentioned the word abortion or termination. Like, this was a woman who wanted a pregnancy, right? I've induced women for chorioamnionitis. I've sent preterm babies to the NICU with sorry, my son is sick, so he's very I might have to leave a little early, unfortunately. I've sent babies to the NICU with with it from an infected uterus. It, it happens. It's a part of obstetrical management. The answer is never, ever, 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 ever sending someone home. Like that, the answer is never. That is never the right answer. Once there's an infection in the uterus, that pregnancy is done. Period. Like there's no more discussion to be had because that baby cannot survive in that womb, and it will kill the mother. And so I don't know what is happening with these laws. I don't know if it's just, I have no idea. I don't live there. I don't practice there. Nobody is really talking very openly about this. But there's no medical textbook anywhere that tells you that you need to do a second ultrasound.
Yeah.
And that's what I want to leave people with is like this is not practicing medicine. This is something else. This is not medical practice because these are the easiest. There are sometimes where things are a diagnostic mystery where you really have to think and it's not clear what the right answer is. And then there's sometimes where the answer is very obvious. Someone gets shot with a gunshot wound. Well, you need to try to remove the bullet to stop the bleeding, right? That's it. Like it's not that much more complicated. This is the same situation we're in now. Next slide. And so I think that, the purpose of this slide is the second ultrasound. There's so many ways this patient was failed, but this changed no management. If I don't know what they're thinking, but you already have the documented no heartbeat. There is nothing that says on any piece of paper and any law that a physician has to document. Oh, so sorry. That a physician needs to document two two ultrasounds showing no heartbeat. It's very obvious. This is a very obvious thing. And so I honestly I honestly I just there are no more I have no more words. I have to move
Yeah.
on before I say something bad. Next slide
Yeah.
because I just
Okay.
have no more words how to explain this. Um this is another patient. Luckily this patient lived. So this was in the University of Oklahoma. She in this situation the ultrasound technician which actually shouldn't no, this is another thing that got me. An ultrasound technician is not a medical doctor. They did not go to medical school. They should not be giving medical recommendations. They should not control your medical care. Um, as a OB, I can do my own ultrasound. I don't even need an ultrasound technician. So I have no idea why this even became an issue, but for this patient's case, the ultrasound technician refused to authorize the exception. I don't know under what planet does a physician practice under an ultrasound tech, but this is what I found. In her words, he insisted that he could hear a heartbeat and told the doctors they could not touch me due to the ban. And the patient remembers the doctors pleading with him. Now, this patient has a molar pregnancy. A molar pregnancy is not a baby. This is like a cancer in the uterus. Right? Like this is not a baby. This is not a baby. This is not a baby. Right? This is an abnormal pregnancy. It needs to be evacuated. And many times it can lead to a malignant tumor. It is something that can kill you. Again, no, this is not ambiguous, right? And so this technician apparently overruled the physicians at the Oklahoma Children's Hospital. They refused again and told her husband to wait nearby, gave them sympathy, and they said that they could not touch her until she was crashing and that we should wait in the parking lot until she was about to die. 2 days later, they drove to Wichita and got care in Kansas.
Mhm.
And this is the worst part. She filed a federal EMTALA complaint, and the federal government rejected it.
Wow.
And I want to be clear, this was under the Biden administration, right?
Oh.
So they rejected it. Another patient. So I think this is the same patient. Yeah, on August 2nd, 2022, at almost 18 weeks, her water broke. She started bleeding, cramping. Again, no viable pregnancy. The maternal fetal medicine that eventually saw her and took care of her wrote, the chance of fetal survival was 0 at this gestational age. And then, you know, again, you we have I have more of these stories,
Yeah.
right? You can go to the next slide. We'll put these out because I don't wanna, I think I've made my point.
Yeah.
But I want people to know that there is so much more to the story than what you are being told, and you don't have to take my word for it. Do your own research.
Yeah.
Look into it. Look into what is happening to these women, because this is not something you wanna figure out when it's your mother, when it's your wife, when
Yeah.
it's your daughter, when it's your sister, right? This is not something you wanna be figuring out when you're in a parking lot. We
Why
have
do
a guide.
why do you think this isn't making more, like, national news? Like, there's no documentaries, there's no like, I just this feels so imperative to get information out to women. Is it because it might cause, like, some kind of a panic? I'm just I'm struggling to wrap my mind around why, um this isn't getting more attention. I feel like documentaries need to be happening and it needs to be on like nightly news and
Well, for me, that this is the Republican Project 2025. This is all what they want, and they've long said that they want to outlaw you know, abortion. And since they haven't been able to achieve that goal yet, they're doing it this way, this end around way, using the politics of fear. It's what they use in every aspect of our society, where they make us so we're so up to our eyeballs in stress, where people aren't equipped. And my heart does go out to doctors. I mean, we've been talking about that. This pressure that we're putting our doctors under, and we're allowing the worst actors in our society to get away with things. And exactly right. We need more people. We need to sit down, everybody we know who has an opinion about reproductive health care, and have them watch this video and then see. And as hard as it is, it's like, look, I understand this is a strong belief for you. Let's sit down and watch this so you are informed. And now you are making an informed decision. And everybody in the chat here, I applaud you all. This is a hard stuff to cover. But I applaud everybody for being here, because we have to know this. And we have to have these informed decisions about our society if we want to make it so that we can survive in this society. Sorry about that. I'm getting calls now too.
Yeah, it's around that
somebody
time.
call me.
Yeah.
I need to get on this train. Somebody call me real quick.
Well, I think so. That's part of why we wrote the book. Is to put everything into one place, because I think if you hear it as isolated story, isolated story, isolated story, it's very different than looking at it one after another, after another,
Yeah.
after another,
Yeah.
with all of the things together, right? As I've told people before, like the data that we're pulling together, like we're not doing primary research. Like the difference between the research we do and the research, let's say I did for my PhD, right? In my PhD, I was doing primary research. I was in there doing the experiments, collecting the primary data. What we're doing now is aggregation. So we're scoring lots of different sources and we're aggregating it together. And the power of that research, right? When you're doing one study, you can say something very specific about one specific thing. When you aggregate across lots of data sets, well, now you can talk about trends, right? They're both important, right? Because the if people didn't do primary research, then we would have nothing to aggregate, right? So the first step is very important, but it answers a very different question. And so I don't know why more people. I mean, I literally this is why I'm like working 24/7, because I asked this question. I'm like, what? Why is nobody knowing this? Like why? Why is no one talking about this? I'm having people on my team like am I like going crazy? Like this should be talked about. And so we're doing everything that we can, but I don't know. I don't have a good
I think
answer
it's
for
just
that question.
it's so nefarious how they pressure people, like rather than a support community, we have all these pressure communities where there's all these threats. And so then you have, and all these situations are kind of heartbreaking, where people are pressured to make a decision they know is not quite right, all the way to the executive board, and at every single step, At every single step, there is pressure to make a bad decision. And so it just kind of gets delayed until we get to that worst possible outcome. And this is how insidious that is. What's it called? The Federalist Society. They know how to just push, and they don't give up, and they don't never even consider humanity. And we haven't fought back, and that's maybe the ultimate thing we have to take from this. We have to stand up and fight back. We have to have these uncomfortable conversations. I said before, if your grandma thinks she's pro-life, you got to make her cry. You got to make her watch this so she understands her position. We can't allow these people to have, and it's like as uncomfortable it is to have those tough conversations, it's a hell of a lot more uncomfortable to be sitting at the hospital having the person you love be kicked out, even though they're in agony because they refuse to treat them. So we just have to understand that's the reality of the fight we're in right now.
And demand answers too, like Dr. Connor said, we know when something's wrong with us. We know when we're not well enough to go home. We know, and I mean, I don't know. I feel like I I have no problem demanding, but it's like I do understand that a lot of people, um, you know, they just don't have the voice or they haven't found that voice yet, but this is the time to really start practicing
Yes.
speaking up and saying those things, and like Walter said, you need to make grandma cry.
Well, and we talked before too. Exercises with your daughters about hell no, this isn't going to
Yeah.
happen because we
Yeah.
don't teach that. We live in this
Well,
patriarchal,
yeah, and let
authoritarian
me so
society.
we have a very practical resource. Aisha, if you could share it with everyone,
Oh,
you can
that would be
it's
neat.
free to download on our website, and this is why we put together our reproductive plan, right? Because you need to have a plan, and you need to think about these things before this situation even happens, before it's because you cannot deal with this in crisis. You do not want to be discovering that you have no idea about your local laws when you're in a parking lot bleeding, right? You
Mhm,
need to have a plan. If you have a reproductive age woman in your household, you need to have a plan. And
mhm,
for the same way that we would all know if somebody has chest pain or if someone starts slurring their speech, you know what to do in that situation. Well, you need to have a plan for this.
I wanted to ask real quick. I mean, before we get to this, where it seems like it's about a 20-hour window where once the sepsis gets in, you're going to die. And so the earlier stages, I mean, we just got to take a fever really seriously in a pregnant
Oh
woman. I
yeah,
mean,
I'll tell you clinically, yeah. So if you have if as an obstetrician, there's a young woman who has a fever of unknown origin and she is unstable clinically, it is the pregnancy until proven otherwise. It is the
okay.
pregnancy. Like that, could it be a pneumonia? Sure. But 18
yeah,
olds
I
are really
didn't
getting
even have I
pneumonia.
had low grade. I had like it was 100.
Yeah,
I didn't even
exactly.
have
They don't go into
it
the
was just
ICU for
100,
pneumonia.
yeah.
Exactly.
Mhm,
So there's only a couple things that put a young so that's the first thing that needs exonerating is the pregnancy. And it's very clear what you need to do. You need to do an ultrasound. You need to do a pelvic exam. You need to make sure her water is not broken. If you are concerned about the fetus being infected, well, there's a way of determining that. You do an amniocentesis. These people are acting like they have no brain, right? There's no ability to deduce this. Like this is
mhm,
just some medical mystery. No, take some fluid out of the uterus, put it under the microscope, and look. Like we do, like that. We can do that, right? You can look,
mhm,
right? If you really are in a place where you don't know, right? And I've definitely done that. I have been in the middle of the night, and I remember. So not all physicians will do that. And that's very fair.
mhm,
Sometimes you need to be at a tertiary care center. Well, send them to a tertiary care center if you don't feel like you can do that and you really don't know the diagnosis. But it is never wrong if she already meets criteria to do the induction. You can or do the DNC. You can stand by that. You can stand by that legally. You can stand by that medically. Like that is defensible. Like
mhm,
the medical legal aspect of that, I think doctors are afraid for nothing. Doctors are very conservative. They get very antsy. It's our nature, right? We're very
mhm,
type A people. But this is also why we do a lot of training for physicians. Um, you need to document it in the chart. You need to use the specific words. You are afraid of and then write the words, right? You're afraid that the mother's going to suffer irreversible harm, irreversible end organ damage, irreversible, things to her life. You and document that and then proceed with your plan. That's what we tell people.
I just wanted to mention too, Daniel had mentioned what's one practical thing to include in a plan, and then Aisha did add the reproductive rights action plan. Can
So we
you
walk you through the whole thing.
well, just so the chat doesn't go with the video once it processes, so
Ah,
saying these
okay.
things out loud is important.
Oh, okay, yeah. No, yeah, so, maybe I can bring it up, while we're talking. But so we have a couple of things. So we tell people to make a plan, right? And what that plan involves is, un- so everyone, again, medicine is defined by your state laws. So go online, look up your state laws. We're going to provide a resource for people to help you navigate that. But until we have that up, you can look up what your state laws are. It'll tell you very easily, very quickly, what is legal and not legal in your. So if you go down, Walter.
Okay. Yep.
And this is your website, just so everybody
Yeah.
knows?
Yep.
hmm
Okay.
And it's laboracollective.com, LABORA
Yeah. If you
collective.com,
go
X
down, I
or
think.
/ products. Yeah.
Perfect.
So if you go down a little bit, yeah, that one, the mini workbook, and you could probably pull it up. I think it's just free available on the website, if I remember correctly. And if not, we'll give it to everyone here.
Yeah.
Yeah.
Um,
It doesn't seem like I can do it here, but
yeah,
okay.
can you just get it?
I
Yeah, hit the
clicked
button.
on it and then it goes back to the top.
Oh, okay. Aisha can send it out though.
Okay.
So Aisha will send it out. And
Well, at least
so
everybody knows where to go,
Yep.
just so they see where to go.
Yeah.
yeah, no.
Mhm.
We'll include the link here.
Mhm.
Um, and so what you need to understand the laws of your state. You need to have the numbers of someone that you trust. And so, not everyone can go to their parents. Not everyone, can go to their partner, right? You need to know who you're going to go to. It could be somebody at work. It could be a lady at church, somebody that you know. And we all have those people in our lives who just think about it beforehand. Who do you trust to have your back if it really came down to it? And then you need to have the numbers of a few trusted physicians. And so you all know me. You can put me on that list. If you reach out to me, people do all the time. I will respond. Like I'm not gonna like leave people hanging, right? I'll give you as much as that information as I can. I can only practice medicine in North Carolina. That's where I'm legally authorized to practice medicine. But I can try to help direct you. I send people to nonprofits all the time. There are nonprofits in your area that can help. I will give you whatever resources I have available. And then you need to have one of the abortion lines on your phone. And the reason that they're important is not just if you want an abortion, right? That's where all the legal advocates are. That's everyone who knows how to deal with the system. That's where they are. That's where that's where they've congregated. So if you are sitting in a parking lot somewhere and you have a miscarriage, well, you need to call them if you're not getting managed appropriately, right? They will help you,
Mhm.
because that's where that expertise lives. And again, it's not just for women who want to terminate pregnancies; it's for all sorts of things.
Yeah.
Wonderful.
Oh, well, my takeaway from this too, I mean, is it is fever the number one thing where we're really gonna be having a likelihood? Or are there other things we can look for? Is there a list where this pregnancy is really endangered?
Fever,
Okay.
abdominal pain, abnormal discharge. Those are the warning signs.
And so I because
Mhm.
this isn't something I even went over when we were having our kids. And it's just like we need men who advocate too. I mean, and obviously we have to help empower the women in our lives to be advocates for themselves too. Like I've
Yeah.
said, I've put my children through workshops where they tell me off. It's like you have to learn how to do that, practice it. Because sometimes you
And
need
I
it.
also don't want people to be scared, right? Because there are a lot of times where you might have a little fever in pregnancy. These women are sick. That's what you all have to realize. It's not subtle. It's not like, oh, she was fine and then she wasn't, right? These women are dying, and that's the atrocious thing. You will know, is what
Yeah.
I'm telling you. Um,
Mhm.
you will know, and trust your gut, right? If the pregnant woman looks sick, if she looks like something is wrong, there is something probably very wrong. It's not that subtle. These women are sick.
Yeah, and don't worry about please, people, don't worry about costs and these issues. Just get in
Yeah.
there and then come and find us and we'll start up a GoFundMe. I mean, just we'll get you keep you alive, we'll do it wherever we can. And I just want the men to be more serious about this too. Don't be wheeling them out of the hospital when you know that there's something wrong.
Yeah.
You're the last line of defense there at that point, especially if somebody's so sick that they can't advocate for themselves. So
Yeah.
these are
And
things. Yeah, go ahead.
and that's why Diosada has the medical model we have. We haven't talked a lot about it, but um, the reason we focused on obstetrical emergencies, so all of these would be considered obstetrical emergencies, right? And what the where we come in is to help. It's more than advocacy. It's to help provide medical recommendations, and confirm for you and the family that standard of care is being met. And so, we're not trying to jam up good doctors. We're not trying to do any of that stuff. It's not because, sometimes in obstetrics, you could have perfectly practiced medicine and bad things happen. That's not where we're not trying to harm people, right? But if you are in a situation, and a lot of these women that are dying in pregnancy, that's what I need people to understand. It is not just like, oh, it was bad luck. A lot of the time it's neglect, right?
Mhm.
It is some things like this. Like somebody should have said without any doubt, should have called the legal department of that hospital and said, "Take this woman to do a DNC right now. Otherwise,
Yeah.
I am gonna bring the full force of the law down at your door."
Yes.
Right? Like, that's what needed to happen, is somebody needed to call the legal department of that hospital on that patient's behalf and just make it very
Yeah.
clear, medically, you are out of line, right? And then we can't force the hospital to act, but usually hospitals are very they're risk intolerant, right? Once they know somebody is actually watching and they have the medical information, I think most hospitals, most providers are going to do the right thing, right? And we hope that we never have to get there, right? But we cannot just keep letting women die just
Yeah.
because nobody's there to advocate for them. It is not the responsibility of the family to do this, right? You come to the hospital and you trust these people. Like, that is one of the greatest honors of a doctor, right? Is within a couple minutes of meeting me, you don't know me from anywhere, right?
Yeah.
But you will put your full trust in me, right? I it's one of the only specialties where within 5 minutes of meeting someone, I can have you in emergency surgery, right? If I tell you right now this baby needs to come out of your body because it's dangerous, something bad is going to happen, most women would say, "Okay, take me for a C-section," right?
Mhm.
And that is a tremendous amount of trust that society has put
Yeah.
into you, right?
Yes.
And that needs to be honored, right? That needs to be honored. Like, I don't understand how people don't take that seriously.
Well, I was going to say we all have to advocate for this kind of conversation. This should be taught in a public school. This video should be taught in public school because what we have is an entire voting population that has absolutely no awareness of the reality of what women are facing in our society. There's no reason we shouldn't be talking about these things. And again, it's that head in the sand, wishful thinking mindset where we allow people to just skip through life with their delusions, and it ends up having these just horrific outcomes that are entirely preventable. That we have to push back against that.
Somebody mentioned rural hospitals, and I just want to just have one clarification. So a lot of these happen in big hospital centers. So it wasn't lack of resources. And I will say this, working in a rural hospital, I much prefer it. There's much clearer um, patient to patient, doctor to doctor relationship. There's not a lot of bureaucracy, right? Because it's a small hospital, right? It's like the same people, the same. And so I can't imagine this happening in a rural hospital. I personally can't. I think as a physician, once you say, listen, we got to take this person to surgery, there's not like a team of lawyers who are going to call you, right? Like, that just doesn't exist. I mean, there might be some lawyer on call who's going to say, "Good luck," and let us know if you need us. But it doesn't have the bureaucratic infrastructure that really is going to. Because these are not rural hospitals. I just want to make that clear.
Well, the rural hospitals are getting shut down too. That's the other
But the
thing.
rural
So it's
hospitals are
like
being shut down.
and that's probably part of the plan. At this point, we should just assume it's malice. It's part of this overall larger perspective to really just torture us, which is because that's what they're achieving.
And you also have to realize the physician that goes and practices in a rural hospital, how should I describe it? You can't be scared. Let's just say that. right? This is not the physician that's gonna be sitting there perseverating. This is not the surgeon who's gonna be like, "Should I take this person to the operating room?" This person works all the time by themselves. Like, that's not the practice pattern in big medical centers. Usually in big medical centers, you have big teams. There are a lot of consultants, and there's a comfort and security for physicians. In rural hospitals, it's you, right? And so you just get more used to acting decisively. That's why I feel like like in a rural hospital, like I can't imagine this happening because like who would stop me? Like literally, who would stop me? Like if I told the anesthesiologist, like, listen, I think this woman's gonna die. I don't know an anesthesiologist, or at least I've never met one who says, no, I'm not gonna give you her anesthesia. If I look an anesthesiologist in the eye and say, I think this woman is gonna die unless we uh, manage this pregnancy, they're gonna say, okay, let's take her to the operating room.
Mhm, mhm. Kim in the chat wanted to know if there's any statistics about how many pregnancies require abortion care before or after birth.
So a DNC is actually very common, and that's the other thing is so the procedure in medicine is called the dilation and curettage. And what this means is we dilate the cervix and we empty the uterus. Now, we do this procedure all the time. We do it in pregnant women, we do it in non pregnant women. That's what I want people to understand. This is a common procedure. If you are 6 years old and I think you might have endometrial cancer and I want to sample the inside of your uterus, I'm going to do a DNC, right? This exact same procedure, the exact same procedure. So it is so common for us. And so all the time we do a DNC. If I feel like, if somebody after pregnancy, if they won't stop bleeding, and I think there might be retained placenta, well, that she needs a DNC, right? Women get it. It's so common. I don't even I wouldn't I don't even know, right? Like it's like being a dentist and like doing like a cavity filling. It's just like
Okay.
we just do it when you see it. Whenever you need it, you just get one done.
Mm.
And so I wouldn't even know how to quantify that.
Yeah, I think it's absolutely ridiculous. I think that, we've abortion has become the boogeyman of
Yeah.
women's healthcare. And it's nothing, it became this dirty word and it's not, it saves our lives. We need them. Whenever we have horrible things happening during pregnancy or like you said, I mean, like I had endometriosis. That's why I had a hysterectomy. I had to have a DNC. I had a miscarriage. I had to have a DNC. That abortion care saves lives, and the fact that it's been just chewed up and spit out and it became the boogeyman of women's healthcare. It just pisses me off to no end. And
Yes.
I just kind of look at
Yes.
people anytime they have this, well, these women are going to these clinics and they're getting abortions to as birth control. No, they're not.
Right.
And I want to make that very clear. Women are not using abortions as birth
No.
control.
Yeah.
I don't
Using
know
it to
anyone
save our lives.
who would
Yeah.
do that.
Yep.
First of
And
all, like a
For one,
DNC,
it's incredibly painful to go
it's
to
incredible. I was about to tell you that. I was about to say a
right
DNC
at
is like, very uncomfortable.
So if
well, and
we're
this
using
misrep
that to as birth control, it's for
yes.
sure, and it's expensive, so
And misrepresenting things is how the Republican Party has worked. Everything that they do on every issue. Immigrants, it's legal to cross the border if you apply for asylum within a year. That's another thing they just get wrong. And we just, in every arena, we just kind of retreat from their framing the issues in these ways that are just malicious and lead to these
Mhm.
awful outcomes. And that's really where the battle is. The battle is in our minds to get this fight back. I mean, and Evie and I were at that point, and Dr. Conrad too. We're just fed up. It's like these last 2 years, we're just fed up with this. All these things that they browbeat us and tell us to behave
Well,
a
it's when
certain way.
you see somebody doing harm, like being a bully, like it just makes me mad. It makes me
Yes.
mad. This should not happen to people. Like someone needs to stand up for these women. It's just that should not happen.
It's getting
It's
harder and harder to have good faith arguments, I think.
Yes. Well,
When people bring things up, you just kinda look at them, 'em, you're like, "Shut up.
yes.
No, that's not what's going on." But, it's one of those things where we still have to kind of a lot of people don't know, and they've been fed this misinformation, disinformation.
Yes.
So, having people willing to have these good faith arguments is still absolutely necessary, but
Yes.
it's getting very hard.
Well, the right always comes at us with this self-righteous, like they've got the moral high ground. They start in that position, and we're just kind of groomed and indoctrinated to
I
retreat.
don't know why we even see that to them. I mean, these people are so
Right.
evil.
That's what I
These
was
people
getting
are
to.
so evil.
We have
It's
to
just
throw
at
it
this
turn it right
point,
back
I
on 'em.
mean, even so one of the oh gosh, one of the AGs responsible for all this stuff is Ken Paxton. Just
Mhm.
do yourself a favor. Google Ken Paxton and the things that he has done.
Yeah.
And then tell me, is he a
Absolutely.
good person?
So
Like,
Ken
is he
Paxton Ken Paxton has, he has multiple homes, but one of his homes is in the neighborhood right behind me, right behind my neighborhood. And every single time it's kind of funny now. It's the one time I'll let my kids like flip the bird every time we drive by the neighborhood. We're all like,
Hey, good. We gotta teach our kids to stand up to authority.
no,
That's
we don't
really
like Ken Paxton. And a lot of people, I'm even noticing here in my very red neighborhood, once the MAGA signs came down and the MAGA flags and they started going back into their hiding, they are speaking out against Ken Paxton. They don't like him. They
oh, yeah.
don't like Greg
He's
Abbott. They don't like Ken
he's a terrible
Paxton.
person.
yeah.
Yeah,
Well, we're
and
just getting
all
started.
all the
Yeah.
things that are coming out about him with the
Oh,
torturing
yeah.
animals and the protecting pedophiles and the stealing the $1,000 pen. Why? You
Yeah.
criminal?
He's corrupt. He is corrupt.
He's
I mean, like, I
incredibly
remember reading a story about him. I'm like, someone needs to write like a
he's a
fiction novel
horrible
about him
human
and use
being.
him as the basis because it is so
Yeah,
absurd. It's like, what?
Yeah.
yeah.
Like,
Yeah.
Like he's lifting candy. "I'm just gonna take this because I want it." Like, how entitled. Who the hell do you think you are, Ken Paxton? I hope he sees this. If anybody knows Ken Paxton, send him this.
yeah,
Yeah.
give him my number. I'll be happy to have a phone call with him.
Oh,
Oh
But
my
a
boy.
couple of things because
goodness.
I can tell already. I know people are gonna have questions about this, so I wanted to just set a couple things straight. So one, Uh, let's talk about the obvious counter arguments. So people who hear this might say, "Well, these women had complications from the, birth. I mean, the abortifactants, abortion pills." And so I wanna just frame this from a position of a doctor. Anytime I give a patient anything, I always say, everything in medicine comes with risk and benefits. This is how I start all of my counseling, right? Let me help you understand what the risks are. Let me help you understand the benefits, and then we make a decision together, right? That is the entire of practice of medicine. And I always tell people, nothing is life is free, right? There's nothing in life that's free. Everything comes with risk and benefits, and then we think about it together. Penicillin has a risk of fatal anaphylaxis. We use it constantly. If a doctor denied you penicillin, because you could have an anaphylactic reaction, that would be malpractice, right? Insulin can cause fatal hypoglycemia. Hypoglycemia can kill you. It's
Mhm.
one of the biggest complications of insulin use. We don't stop giving diabetics insulin. Aspirin and other blood thinners, they cause GI bleeds, they cause hemorrhagic strokes. Millions of people, probably many people here in the audience, you're on an aspirin right now. It's because the strokes and heart attacks they prevent are worse. A colonoscopy can perforate your brow. You still need to get your colonoscopy every year, right? Or like every 10 years, right? Depending on what your doctor, every 5 to 10 years, right? A C-section, we do over 1 million a year. They can cause hemorrhage, infection, injury, anesthesia. Some people die from anesthesia. It kills people, right? Again, everything in medicine has risk and benefits. That's what medical management is. We give you a treatment, we understand the complication rate, and then we watch for it. We treat you if that complication happened. So that's what happened to Amber Thurman, right? She had retained tissues. We know how to treat retained tissue. We should have given her a DNC. We failed to do
Mhm.
that, right? And so the complication is not the problem. The complication is a known part of practicing medicine and why physicians have the job that we have, right?
Mhm.
This is why we are trained. And so you cannot use that as an argument against the medication itself. Otherwise, there would be no medicine available for anyone, right? Because every medicine that you are taking right now, I promise you, someone has had a complication from that, and that
Mhm.
complication was managed by a physician. This is literally what we train for. The other thing I want to also be clear is many of these women were not trying to end a pregnancy, right? I just told you, Navia Crane, she was 6 months pregnant. She was having a baby shower. She was celebrating, right? The patient with a partial molar pregnancy, she wanted that pregnancy, right? There's no baby to save. Another patient who broke her water at 18 weeks. The fetus is not going to survive, right? And so none of these women came into this situation wanting to end a pregnancy. And so when people are talking about abortion as birth control, first of all,
Mm.
that's something that they made up in their mind. I don't know anyone who does that. I've been doing this for a long time. I've never met a woman who uses abortion as birth control. Period.
Right.
I haven't. Whenever I have met a woman who's had lots of terminations, you know what you need to ask her? Are you being trafficked? Because
Yes.
that's usually it, right? When a
Mhm.
woman has had 10, 12 terminations, that's a warning sign, not like she is, a terrible, horrible
No.
person. It's who is trafficking you,
Yeah.
Mm.
right? Because a lot of times when I see that, that woman is being trafficked. I don't want to say too much, but
Yeah.
I have had many situations where people are looking at someone's history and judging them, and it turns out they're in a very dangerous situation. Because think about it. Why
Yeah.
would you do that to yourself?
Yeah.
People
Mhm.
don't. People wouldn't unless somebody is making you. And a lot of the times that's the thing that people are not asking. They're not asking, well, why is she having so many unwanted pregnancies?
Yeah.
Right? That doesn't sound like a loving partner. That
Mhm.
doesn't sound like a partner who's respecting her boundaries. Right?
Mhm.
Why is a woman getting pregnant that often if she doesn't wanna be pregnant? That's a warning sign, not something against her. That is a warning sign that something is wrong. And so everything about this argument is so messed up, and it's just so twisted. And again, like,
Yes.
this is how they hurt women. And then my last final point that I wanna make, when you compare mifepristone, the danger of mifepristone, to the danger of pregnancy,
Mhm.
pregnancy is much, much more dangerous. The abortion-related maternal mortality rate is about 0.31 per 100,000. For pregnancy, if you're Black, it's almost 40 per 100,000.
Mhm.
Oh my
Mhm.
god.
If you're white, it's a little under 20. And so pregnancy is more than 20 times more dangerous,
Yeah.
right? And so again, we gotta know what we're talking about. We gotta have the data that we're talking about, right? Yes, these medications cause complications. All medications cause complications, and physicians need to manage them, period. That is not an argument for anything.
What my takeaway from today is just illustrates this Republican strategy of deliberate pressure at every point of vulnerability. Like, they will not support us in anything. They always say they go into government to dismantle government. They attack. I mean, we need to give support to our educators. They take that support away. And it just leads to people being stressed on the job. And then when you're stressed on the job and you make a mistake, then the Republicans come at us again. And it's just like, why do we tolerate this ideology? The only thing they do is they wait for us to have a bad moment to pounce on us. And then they tell us that we're worthless and that we deserve all the bad things, exactly like you were saying, accusing people of all these awful names when clearly they're being trafficked, clearly they're being abused. But the Republicans are always going to turn around and say, well, that's your fault because of bad things that you're done. It proves that I'm right and that you're a bad person and I get to torture you. And at this point, we just have to wake up from this. We've endured this for so long. There's no more reaching across the aisle to this ideology. Look what they're doing. Everything that we've talked about, the deliberate attacks on every level. They're dismantling the hospitals. They're attacking the doctors. They're attacking the review boards. People on review boards are losing their job. They're erasing the data. And it's just a steady erosion. They're just like scraping a little bit because they can't make, these things outright illegal. They don't have that power yet, but they're not giving up. They're not respecting our laws. They're just going at us at every vulnerable point. They're saboteurs. And it's like, as a parent, you try to raise your kids, you do the best you can. But if they have just a moment of vulnerability, they get an A minus on a test. Somebody can go and say, well, say all these awful things and cause this damage that's so hard for you to overcome, right? And that's their overarching philosophy and everything that they do in our society. And I just need people to just start waking up and recognizing that that's what we're up against. Stop making excuses for them and certainly don't retreat. Don't cede, as Dr. Connor says, don't cede the moral authority to them. Because look at how awful they are to us. Look at how much they're abusing us.
Mhm. Mhm.
Yeah.
Yeah. I mean, there's so much. I think we had a great conversation. We might I told Aisha to tell you all that, like, we'll try to fit everything in, like, 7 episode, but I don't know if we'll get through everything because there's so much
We'll
more to
keep
talk
going.
about.
We'll keep going
We
until
have like
everybody's
You know,
incarcerations.
Dr. Connor, we continue the conversation until they listen.
Yep,
Yeah.
We continue it
yep,
until it's done. So, I'm in it for the long haul.
yep. We're not
Yeah.
stopping. Heck no. Nope.
Um, so we have a part 2, but I think, I wanna give the space that these women deserve, and so, we can come back for the second part of this, and so the second part is going to be talking about, the financial part, so what is happening from a financial perspective to medicine. Like, what are the programs being cut? So we can talk about Medicaid, we can talk about Title X, we can talk about CHIP, we can talk about the ACA. What do they
Yeah.
actually do in our healthcare, and what is being dismantled? Because I think it's really important that people you can get it all like all mushed up together, but these are distinct programs that have a lot of benefit that we all depend on, even if we don't realize it or not. Right?
Mm.
Medicine is it's like everything else, right? There are we stand on each other, right? None of us live in isolation, right? These systems are meant to work together. When one piece falls, that hurts everyone. When a rural hospital falls, it hurts the people in a suburban community. You know why? Well, now your units are going to be overrun. Now everything's going to be much more expensive. Now the emergency room waits are going to be longer. Now people who probably should have had low risk care are going to have high risk care. And so if you come in with the freak thing of nature, right? The zebra, the thing that really does need, 20 doctors around your bedside, thinking long and hard about it. Well, there's not going to be that dedicated time and space for
Mm.
that, right? Because those same doctors are managing things that should be better managed in a community. That's why it's a system. The system is important, and maintaining the system is important for everyone's health. You want to be able to go on vacation, right? You want to be able to, if you have a lake house, you work really hard for that lake house. You want to go at the beach, right? Well, Brigham doesn't sit on a beach, right? It will never. You will never have a big medical center in these rural communities. Makes no sense. You have to have them in big cities, right? You have to have them centrally located. They're very expensive to run, and we don't need many of them, right? The way the system is supposed to work is you have your rural communities, you have your community hospitals, and they act as as a triage essentially. And the people who they can manage, they manage, right? And you keep them in the community. And the people who really need the tertiary care, they get sent there, right? And that's how we create a system that can take care of everyone. Right now, people are acting as if, like, if you live in a city and you don't care what's happening in rural hospitals, well, you don't understand how the medical infrastructure works
Mhm.
Mhm.
because
Dr.
it is
Connor,
hurting you.
I just wanna say thank you so much for bringing light to these women's stories because, these women deserved to have a full life, and those children that they left behind deserve to have a mom and grow up with a mom, and because of all of this negligence that happened and they lost their lives, I don't want them to be forgotten. I want people to talk about them, and today's conversation was really tough. It was even tough for me. I mean, I even kind of like, couple times, I could feel my eyes welling up with tears because I remember being scared, but I don't remember, like, I just know that that situation could have been so much worse if I didn't get the care that I received, and you just told the story of the worst. So, um, please share this, everybody. Let these women live in memory. Let these women's stories really go forward because we need change. This is killing women. This could kill your daughter. This could kill you. And, Dr. Connor, I don't think you understand how much, I appreciate you for doing all of this work and for being the voice and bringing this all to light, and I'm so grateful to be a part of this. Um, I I just, these stories were horrible, and but at the same time, they're still so important, and we have to tell these stories. We have to. So, with that, that's my takeaway on today's segment. Um, I I know it's bad. I know it's always been bad as a woman. I know that we've always kind of gotten second rate everything when it comes to, just being heard and getting the care that we need. But this is horrible. And whatever we can do to bring more attention to this, I mean, please let me know. And, Walter, you're amazing. Thanks for platforming this for Dr. Connor and anything I can do to help, I'm here for you.
Yep.
Well, thank you, everyone. Yeah, so thank you. I think this was an important discussion, and we're gonna pick up next week. Just go be with your loved ones. Give your kids a kiss. Give your mother a kiss. Call a loved one. No one should have to die this way.
Mhm.
I wouldn't wish this on my worst enemy. I wouldn't wish this on a horrible person. Like, no one should have to die in agony while people watch them die. We all deserve dignity. We all deserve respect. And these women were not given either of those things. And it's preventable. This did not have to happen.
Yeah. Oh, thank you, you two. It's always my great honor and privilege to spend some time with the two of you and all the wonderful people in the chat. And I wish we had a bigger platform to get this more visibility, but I know the people here will do that work for us. And I just want that takeaway. I mean, we got to know this is deliberate. What is happening now is a deliberate act, but it can be fixed. We can fix this. It's not going to happen. It's not going to fix itself. That's the thing. We have to fix it. We fix it through these conversations.
And I wanna tell people, we know this is what we know of, right? There's probably a lot of harm that's happening that we have no idea.
Yeah.
Because the people who are most at risk, they have the least voice, right? These people had all of these people were partnered, right? All of
Mhm.
these people had family that loved them. All of these women had that's why we know their story, right? Who's getting their story out here? Their family is. There are probably so many women who are dying alone that we have no idea. So we have to start telling their story. We're gonna start collecting, like, stories from patients and the community to try to get an understanding of what is happening.
Mhm.
Because even if the government shuts off our ability to monitor this, we have to take care of each other. And the first step of being able to take care of each other is we've gotta know, right? We gotta know what's going on. We have to know what's going on in rural communities. We gotta know what's going on native reservations, right?
Mhm.
We probably should have some dedicated time just on that topic, but there's a lot of harm. There's a lot of harm happening, and there's such a small population. Nobody is telling that story, and
Mhm.
it is heartbreaking, some of the things that we're learning.
Yeah.
Right.
And bring those stories to us and we'll share them here too.
Mhm.
We're going to continue to go, as we said. Well, I know you have a sick one to go attend to, so and we've kept you long. But again, everybody, please share this. Go talk to
Thank you,
people.
everyone.
Somebody said share these videos at your church. I think that'd be a good idea too.
Yes.
Do it. You know, do it. Make them see the truth. Make them see
Mhm.
reality because reality is not going to change unless we make it change. All right.
Mhm.
Again, thank you, everybody. It's been wonderful having the two of you here. I really appreciate you and all
All
that
right,
you
thank you, everyone. Bye.
do.
Bye,
Bye.
everybody.